So what screen do you see?
First one, introduction.
Okay, now
Yes, we can see. Second
it's
one.
changed. Okay, great. Thank you. Bands and the requirements. Okay. So these are to do with what are the band scores and what are you assessed upon writing. Okay. So for writing, you are assessed on these different parameters or assessment criteria. One is purpose. Purpose is the first paragraph where you have to write what is the purpose, why you're writing to the other professional, why are you writing the letter. You also have to write the diagnosis. So the purpose of the document is immediately apparent and sufficiently expanded as required. Then you have to see the other 5 parameters here. One is content, conciseness and clarity, genre and style, organization and layout, language. These are the 5 other parameters or assessment criteria. The purpose carries 3 marks, and content, conciseness and clarity, all the others carry 7 marks each. These are the band scores in terms of your equivalent to your IELTS pattern. So they are assessing you on all this. This is the structure of the letter. What should be written? You can write the date at the top, or you can write the date even after the address is okay. So you can write the date first. In this format, you can write DD, MM, YY, YY. That means date first, and the number, the date, then the month, with 0 before the month. Till September, you write 09, and from October, you write 10. So that is a DD, MM, that's month. Then YY, write the 4 numbers for the year. Don't write only 20, right? 2020 or 2021, 2022, etc. After the date, you write, and whenever you write the letter, please write the current date. On the day of the exam, you have to write the date of the exam only, not on the based on the date of the date of admission or date of discharge. Please don't relate it to that. This date is the date when you are writing the letter. So during training, all of you are going to do the letter today. Please write the date as today's date and not the date based on the case notes. Okay. Now, after the address, you see the address in the case notes. The end of the case notes, it will be written writing task. In the writing task, it would be given as to who you're writing the letter to with the address. So this letter is to a physiotherapist. So the name comes first, full name of the person, then the title, the designation, that is physiotherapist, then the address, what clinic they're working for, the name of the number, name of the street, and the town, the town's name at the end. Then you have to write the salutation. This is called salutation. Dear Miss, and you write the surname of this person. Whom you're writing? Miss Loretta Pasquale. So here you don't write Loretta, you write Miss Pasquale. Always write only the surname in the salutation. Dear Miss, if it's a doctor, write Dear Doctor and the surname. If it's a nurse, head nurse, write the nurse's name with the surname, not the first name. Then you write reference. Reference is the patient's name. The letter is regarding who? It's regarding a reference. So you write the full name of the patient, RE and a colon. Don't put colon dash, or don't put only a dash, or don't put semicolon. RE only, R should be capital letter and E small letter. If you want to write both capital letters, it's also fine. You can write R and E both in capital letters with a colon, then 1 space, and then write the patient's name. So in this case, the patient's name is Mr. George Cheng. So write Mr. George Cheng, full name, a comma, leave 1 line with 1 space, right? 54 years old. That is the age. Or you can also write aged 54 years. Or you can write 54 years old. If you write aged, you don't write old at the end. You just write aged 54 years. Don't write aged 54 years old. Both are not required. Either write aged 54 years or 54 years old. If you also write only 54 years, it's fine. It's okay. After the age, the name of the patient and age, the full stop, leave a line space. After you leave a line space, you start with the first paragraph, is the purpose. So Mr. Shen requires your professional assistance for his ongoing difficulties with mobility following recent surgery. So we know why you're writing the letter, follow-up treatment. So they want that that physiotherapist, Mr. Pasquale, has to continue. This patient has undergone a surgery, so he needs physiotherapy. So you're referring your patient to him for whatever ongoing physical difficulties he has. He needs mobility. He has difficulty with mobility, unable to make him completely mobile. Whatever physiotherapy has to be done, this physiotherapist has to assist this patient. So it's very clear in the first paragraph what you're writing for, why you're writing the letter, what should that professional do for your patient. It's very clear, and it's also written that he has undergone a surgery. So this is sufficient in the purpose. Make it as brief as possible with only two details. Referring the patient, that is, what is the type of letter, referral letter, referring the patient for what purpose, ongoing difficulties with mobility. So the physiotherapist knows that he has to address that problem. What problem he has had, surgery. So these 3 points come in the purpose. That's it. Don't make it very detailed. Don't give any more information in the first paragraph. This is called the introduction paragraph. Now comes the body paragraph. You can have 3 body paragraphs. You explain the purpose in detail. You're expanding on the purpose. Mr. Chen was admitted to St. Andrew's Hospital 2 days ago with swelling and fluid buildup in his right knee, with fluid buildup. So the result of a total knee replacement, which he underwent on 27/12/2017 due to osteoarthritis. So he underwent this problem. So what he presented with swelling and fluid buildup in his right knee. What was done about it? Total knee replacement was done. He underwent that procedure. He underwent in 2017, but his letters written in 2020. So they're not relating the date to the surgery. It's not that they're writing referral letter after 3 years. It is because this particular letter, this OET candidate has written in 2020. So they've written the date as 2020. Okay? Please don't mix up with the dates. Many people get confused with which date to write. On top, you're writing the date when you wrote the letter, when you are writing the letter. What comes in the case notes, those dates have to be put exactly as they are. Please do not change any information which are given in the case notes. You cannot change any date according to your convenience. That data has to be accurate. For content, you get 7 marks. If you change the content, you will lose marks in that area. Then what happened? The resulting pain and swelling have severely limited his mobility. So they're saying what is the result after the surgery? Pain, because of the pain and the swelling, his mobility has been affected very badly, severely limited. Consequently, self-care activities have been significantly compromised. Because of that, it has affected his day-to-day activities. Now, during Mr. Chen's time in care, the swelling was successfully treated by use of ice packs and painkillers. It was noted the incision site had healed well. His mobility was supervised. Please mute yourself. There's some background disturbance. Please keep yourselves on mute. Who's that? Given, please mute yourself. A lot of disturbance. Okay. So then pain was controlled with ice packs, right? And painkillers were also given, which helped him. Then after the surgery, the incision site had healed well, and mobility was also being supervised. He was given the use of a front wheel walker to assist in this. For his mobility, walker was provided. He still experiences a limited range of motion. So his ROM is limited, managing less than 100 meters when mobilizing with his front wheel walker. So even though his surgery was successful, it was very his mobility was supervised, but still his range of motion has not come back to normal. So he can walk up to maybe less than 100 meters using the help of the front wheel walker. What is needed now? Mr. Chen is now medically stable and ready for discharge with the assistance of his family, who will supervise his self-care activities, including bathing, grooming, and lower body dressing. So he needs help for his daily activities. His ADL, that is daily activities, have to be supervised, and he needs care for that. And he also requires physiotherapy for his range of motion to improve, and for him to do better with his mobility. right? So now what are we doing? We have said what the problem is. We have expanded the purpose. Now the physiotherapist knows exactly what has been done, what has to be done, where are his difficulties, and what are the supervision provided. And now we are requesting the physiotherapist in the next paragraph kindly provide acute and comprehensive rehabilitation of Mr. Chen's right knee. So we are making the request here directly to provide acute and comprehensive rehabilitation. The physiotherapist knows what has to be done, they will take care. If you have any queries, please feel free to contact me. This sentence should be at the end. This is the conclusion. So here you have expanded the the purpose you have expanded into 3 paragraphs. Now you are saying what you want, you're requesting again formally in a formal way, and you're always keeping the access open. That is, you're always telling the person that if they need any further information or any questions regarding this patient, you will be available for them to help them with the information. So this sentence has to be there in all your letters. If you have any queries, please feel free to contact me. Then you leave a line space. You can see here between every line, between every detail, is a line space. Between the date and address, 1 line gap. After the address and dear salutation, 1 line gap. Between this, 1 line gap. Here, 1 line gap. So please remember, one standard rule is 1 line space between all the paragraphs. And after the end conclusion, leave a line space here and give your sign off. Signature line, yours sincerely. If you know the name of the person you're writing to, dear Mr. Pasquale, you know his name, you write yours sincerely. Suppose they don't give the physiotherapist's name, if they only say write to the physiotherapist of this medical clinic, then you don't know the name. In that case, you'll write dear sir or madam in the salutation. And here at the end, you will write yours faithfully and not yours sincerely. Okay? Only if you know the name, you write yours sincerely. After this, yours sincerely, leave a line space and write nurse, because your authority is your writing from the position of your being a nurse. You have that authority of writing this letter. So please don't write your name at the end. If you give name in the case notes, then you need to give the name at the end after your designation. You can write, if they're saying you are Ashwati, head nurse of St. John's Medical College Hospital, then you have to write write your designation, head nurse, comma, put a comma, then write your name below that, Ashwati, full stop. You can put a full stop. But if there's no name given, they just say you're a nurse writing to the physiotherapist, Miss Loretta Pasquale, then you don't write your name, you just write nurse at the end, as it is given here. So if you want to, you can take a picture of this structure. If you want to take a screenshot, please do so. Now moving to the next slide. It gives detailed analysis of the structure and what has to be written. Which date should be mentioned in the letter is, what is the question? What's the answer? The date of the exam, not that of the discharge or admission date of the patient. Even though there might be multiple dates available in the case notes, the date that you should be writing either before or after the address. I told you can write the date before the address or after the address. It can be in both, any one of the places. Both are correct. That should be the date of your examination. In the training, it should be the date of your training date. So today, when you're writing letter, write the date as today's date. It is the format. So today's date is 1st February. You write 1st February. What is the date? Format of the date? DDMM Y. So today's 1st February, write 01. Then you can write slash or dash 02 slash or dash 2022. If you want to write the month fully, it's also fine. You can write second, an ND on top, the ordinal number for second, an ND on top, smaller letters, then space, February, F should be capital letters, and write the full word February, comma, 2022. Please do not write only FEB as a short form. Don't write Jan, Feb, and OCT for October, NOV for November. Do not write short form. You should write the full month's name. You can just write 01, 02, 01 dash 02 dash 2022, 01 slash like this, 02 slash 2022. Okay. Now, detail analysis of the structure and what to be written in the address. Regarding address, copy what is given in the case notes. At the end of the case notes, it will be writing task. The address will be provided there. Write without any spelling errors or any mistakes with regarding to capital letters and punctuation. So the names of the people should be capitalized, name of the title, if it is Mr., Doctor, so you have to write B capital letter, small r and dot, or if it is Mr., capital M and R, small letter dot. If it is MS, you put M capital letter, small letter S and dot. Capitalization is very important. Name of the clinic, name of the hospital, all the first letters should be capitalized. Punctuation, if you want to put commas for the address, you can put for all the lines, use commas. If you're not using a comma for one line, don't use comma for any line. Regarding, RE, this is regarding, the regarding RE dot colon or RE small letter E or capital letter E, both are accepted. The colon after that, punctuation is important. Then this includes the patient's full name and the details like age. Again, this will be provided in the case notes. You have to see the correct spelling and write according to the title also. If it's a Mr. or Miss or Mrs., please write that correctly. Detailed analysis of the structure of the what has to be written in the body of the letter, as I told you earlier. Categorize them into paragraphs. First paragraph is a purpose statement, the reason as to why you're writing the letter. Give the reason clearly with the diagnosis, or if it is a surgery, say about talk about what surgery it was. Extended purpose. So now you're expanding on the purpose, extending. You're giving more information. Write more about the purpose of the expand the purpose using the key details and other significant aspects that can be extracted from the case notes itself. Please do not write anything of your own. All the details should be from the case notes only, not from your medical knowledge. Secondary and tertiary issues. If they have any other related issues, like the relevant details about the patient's case, you can give that have not been mentioned in the previous paragraphs. You can include them here. Every minute detail about the patient's stay and progress has to be given in the body paragraphs. So how long they stayed, what was the progress, what were the medications given, what are the vital signs, did they improve after the medication, or like you saw in that sample letter, it said that patient is stable. Sometimes the patient may not respond to some medicines or to some treatment. You have to give those details. Like you said, like they said, the patient is stable, still range of motion is limited. That is a limitation that has to be addressed, and continuous treatment has to be done till the patient is completely all right in terms of difficulty with mobility. The fourth and next paragraph at the end, the ending part is requesting. Summary of what you need, or what you're writing this letter for. That purpose has to be reiterated at the end. Make the formal request again. From your side, what is the request you're putting forth? You have to give it at the end again to make sure that the reader knows again why you're writing the letter, and leave a line space and give your sign off. Before sign off, like I said, to write, please feel free to call me if you have any queries. And then sign off, yours sincerely, comma, or yours faithfully, comma, depending upon whether you have the name of the receiver or not. If you have the name of the recipient, write yours sincerely. If you do not have the name of the recipient, the person receiving a letter, please use yours faithfully. Put a comma and then put the designation at the end. Okay, so this is the format of the letter. I'll show you another small PPT, which is on with a few other strategies to get more marks. Okay, I'll share a PPT with you, which is giving you some tips as to how to obtain more marks or higher score in writing. Just expand the screen. Is my screen visible?
Yes, ma'am.
What do you see on the screen?
Hooray OET strategies to obtain more marks.
Very good. Here, this PPT deals with strategies to obtain more marks than just passing marks. These strategies are provided in these slides. These strategies help you to combat the common problems you face while writing the test. So let's look at these details. These slides. Okay, please keep yourselves in mute so that we won't get disturbed by the external sounds. Repetition of key nouns. If you see this, while using key nouns, it is okay to repeatedly use them in the sentences, as the main aim of the letter writing is to provide clarity. One example is this. Mr. Smith was admitted to Xavier Hospital Emergency Unit on February 2nd, experiencing florid psychosis. The nature of this psychosis was characterized by paranoia. He was not violent in any way. However, he claimed to have not had a psychotic episodes prior to this event, though psychosis does not run in his family. Now you see this word psychosis, the noun, it is used 4 times, right? So instead of using, okay, sometimes you can use this noun if it is to, really provide clarity and to give emphasis. But in the next slide, I'll show you now some other words which can be used instead of the word psychosis being repeated. You can use other nouns to help you. Now let's look at this slide. Use synonyms or pronouns. Synonyms are different words which give the same meaning, or use pronouns. Pronouns are words used instead of the noun. If the words become too repetitive, the word is being used in consecutive sentences like we saw on the previous slide, then it is better to opt for synonyms. That is words with different meaning, different words giving the same meaning. To replace the repetitive words or pronouns which indicate the noun, but we do not use the same noun itself. Now the same paragraph is used here, written with different words. Mr. Smith was admitted to Xavier Hospital Emergency Unit on February 2nd, experiencing florid psychosis. Psychosis used only once in the beginning. Nature of his episode. See, episode is used instead of saying psychosis again. The nature of his episode was characterized by paranoia. He was not violent in any way, however. He claimed to have not had any such experience. So the word experience is used. That's again referring to the psychotic, the person's episode. But it's used as another word which refers to the same thing. It's a synonym. No, he claimed not to have had any such experience prior to this event, though the issue does not run in his family. So they're saying the issue instead of psychosis. So you see, 4 different words are used, but all are referring to the same noun, which is psychosis. Psychosis, episode, experience, the issue. You can use synonyms or pronouns relating to the particular noun. Now you also have to use appropriate linking words. Using linking words like these, however, moreover, firstly, secondly, furthermore, henceforth, etc., provides a more refreshed and fresher approach to the information being shared. It provides a continuation and a flow to the paragraphs that are being stated. So it gives continuity, it gives cohesion. Linking words always are cohesive devices which show connection between one idea and another. It is showing the continuation. There's a thought process going on. It's not that a person is jumping from one sentence to another, one idea to another. When you say firstly, secondly, thirdly, furthermore, in addition to, moreover, hence, however, these are all words which show good connection between your thoughts and ideas. So please use linking words to give good cohesion to a letter. So the reading shows good writing skills. It becomes easy for the reader to help to understand what the situation is in a very clear way. The next point is sentence structure and sentence forms. Use simple, active sentences which could guarantee you passing marks. But if you are looking for better marks, just better than passing, use different types of sentences like compound sentences and complex sentences. And both active voice and passive voice can really boost up your scores. For example, the doctor prescribed medicines to the patient. This is active voice. What did the doctor do? The doctor prescribed medicines. If you want to put this in passive voice, you say the patient was prescribed medicines by the doctor. Now for OET writing, letter writing, I prefer passive voice rather than active voice because It's not a personal letter. You're not writing a friendly letter to another medical professional. You're writing a formal letter. It's not an informal letter. When it is formal, when you use passive voice structures, it gives more of a formal tone. So it is advised that use formal structures rather than active voice. Use passive voice. It gives more of a formal nature to the letter. It gives a formal tone. And also you can write compound sentences instead of writing two simple sentences. You can combine two simple sentences and make it into one compound sentence using conjunctions like and, because, so, since. This way, you're not using too many tiny sentences which you could just get maybe a passing mark. If you want a higher score, an A grade, you have to use some compound sentences, a combination of compound, complex, and simple sentences, a combination of active and passive voice. These are also some tips for you to obtain a higher score. So this is the end of this PPT. There are other PPTs which I can show you in the next class for writing. So if you have any questions now regarding these two PPTs, what we have discussed now, the structure and how to obtain better scores, please feel free to ask me now. Thanks a lot for listening to this session. And now we are going to go into the writing part. Before that, do you all have any questions before you're doing the practical exercise?